Good morning everyone. I am Dr. Santosh Kumar, Orthopaedic and Joint Replacement Surgeon based in Kolkata, and I am associated with Belle Clinic and Woodlands Hospital. Along with this, I head the Poorva International Orthopaedic Foundation, which is a foundation, orthopedic foundation for the purpose of bringing world-class orthopedic surgery right here in Kolkata at the most affordable price. So we will be holding some discussions and seminars on various types of fractures that we normally we get. The most common of them is fracture neck femur. Fracture neck femur is one of the commonest fractures that we see on our society. So why does this occur? See, this is basically a fracture of age. What it means is that with age our bones become soft and they become weak and fragile, and that leads to fractures at multiple areas of the body, the most common of which is neck femur fracture, or the most devastating of which is neck femur fracture. So I have got many questions which we will be discussing, and we will be discussing the answers, and we will be trying to understand how the treatment takes place and what is the outcome of that treatment. So the first question that I have got is what are femoral neck fractures? Can you please tell me what are femoral neck fractures? So to understand that, let's see this diagram. So this is our pelvis bone and the hip joint. So this is the pelvis bone and this is the thigh bone. So the joint where the pelvis and the thigh bones meet, that is known as hip joint. So we have two hip joints, one left and one right. So this hip joint is made of one ball, which is the head of the femur, and other one is the socket, which is the acetabular cup. So this is the type of ball and cup joint. This is ball in socket joint, and this is the one of the largest joints in the body, and this bears our body weight. So this hip joint, it has got several components, the three components. One is the cup, which is known as acetabulum, the ball, which is known as the head of femur, and the part which connects the head to the shaft of the femur, which is known as the neck of the femur. This slender thin part, this is known as the neck of the femur fracture. Now, of all the places, neck femur is the most susceptible to fracture because it is susceptible to torsional stress. It is susceptible to torsional stress, and this is a site of osteoporosis. The bones in the neck femur, they become soft and fragile, which leads to multiple fractures while there is indoor fall or there is twisting. So the same thing if we see in another picture, this is the pelvis and the hip. This is the pelvis bone, this is the thigh bone, and the place where the pelvis and the thigh bones meet, this is known as the hip joint, and this is known as the hip joint. So this hip joint is made up of the cup, the head, the ball, which is known as the head of femur, and the part which connects the head to the shaft, that is slender thin part, which is neck of femur, which is most susceptible to fracture. So this fracture is at various parts. So this picture we see this neck femur fracture, neck which starts from the head to the shaft. So this whole area is known as the neck of femur. Neck of femur is the part which is most susceptible to fracture. Now this is of various types. One is the subcapital fracture, the fracture which occurs just below the head of the femur. This is known as subcapital fracture. The fracture which occurs in between, the midway between the head and the shaft, this is known as transcervical fracture, and this is known as basicervical fracture. Now these three types of fracture are well within the capsule of the hip joint, so they are known as intracapsular neck femur fracture. These three fractures, that is subcapital, transcervical and basicervical fractures, they are well within the hip joint, so they are known as the intracapsular fracture. Once we go further down, like this type of fractures, they are known as the trochanteric fracture or the extracapsular fractures. So the difference between intracapsular and extracapsular fractures is that intracapsular fractures, several times they are replaced by a prosthesis, which is known as hip replacement, but extracapsular fracture is always fixed. Extracapsular fracture is always fixed either with screw plate or with nail. So in the same thing we can see clearly in this diagram. This fracture of neck, which is well within the capsule of the hip joint, is known as intracapsular fracture, and this fracture of neck which is outside the capsule of the hip joint is known as extracapsular fracture. Extracapsular fracture is almost always fixed, and intracapsular fracture can be replaced or fixed depending on the particular situation. So what are the treatment options that we have for neck femur fracture? We'll just see. If it is an intracapsular fracture, we try to repair with cannulated hip screws. Multiple screws are put, but there are several criteria for it. When we will put that, we will see it subsequently. If it is an intertrochanteric or extracapsular fracture, it is repaired with a screw and a plate which is known as dynamic hip screw. This is known as dynamic hip screw. Now the next question I have got is what are the causes of this femoral neck fracture? Femoral neck fracture, well, the femoral neck fracture is almost always caused because of osteoporosis. It is the softening of the bones, it is the fragility of the bones which lead to this fracture with low velocity impact. Means there is no massive impact, but there is a fracture. This is known as low velocity impact. Next question I have got is how do you diagnose the femoral neck fractures? Femoral neck fractures, a person with femoral neck fracture will not be able to stand and walk, and he or she will be lying down on bed with it will appear as if the leg of the person is beyond the control of that person, is not in the control of that person. It lies rotated, and it, in our language we call it helplessly externally rotated. So it appears as if the leg is lying without the person having any control on it. And how do we diagnose it? Most important is X-ray. We do a plain simple X-ray. We do a plain simple X-ray, like this is the X-ray of the hip joint. This is a normal X-ray wherein we can see the cup, which is the acetabulum, the head of the femur, and this portion is known as the neck of the femur. Along with it we have the shaft of the femur. So in X-ray we can see the fracture line. This is an undisplaced fracture, means fracture is there but it has not displaced. Similarly, this is an undisplaced fracture. Fracture is there but it is not displaced. And there are displaced fractures, means in this case we can see that there is a clear-cut fracture. This side is normal, you can see this side is normal. This is the head of femur, neck of femur. In this side you can see the fracture line, and the neck of femur is reduced because the bone has fractured and it is overriding, it is telescoping into the other one. So this is displaced neck femur fracture. So X-ray we can see that position of the fracture, whether it is displaced or undisplaced. The treatment depends on that. That's why the X-ray is the first and foremost that we need to do. So here we again see in X-ray, this is displaced neck femur fracture. This is a displaced neck femur fracture. So along the various treatment modalities that we have, if it is a intracapsular neck femur fracture, we put multiple screws in it. Like this. This is 6.5 millimeter cannulated cancellous screws. So these 3 screws in multiple directions, we use it for fixing the neck femur intracapsular fracture. So in X-ray it appears something like that, and this is the model. So for this to be done, it is important that it is relatively early, means it has to be done within 24 hours. First thing. Second thing, the person should be physiologically fit. I mean, the person should not be very old, otherwise the chances of uniting is less. So this is one of the treatment modalities. The advantage in this treatment modality is that the natural head of the femur, the natural hip joint is preserved. There is no replacement being done, the natural hip joint is preserved. The same thing we are showing in X-ray, multiple screws are there used to fix the fracture. Now if the fracture is extracapsular, that means outside the hip joint capsule, then we fix it with nail. This is known as proximal femoral nail. This is fixed with nail and a screw. The advantage of this nail is that it's a minimally invasive, it's a keyhole surgery. This nail can be put by giving a 1 inch incision, and it is slided inside the bone. This nail is inside, this rod is inside the bone, and there is a screw which fixes the neck femur and the head femur. This is known as PFN or proximal femoral nail. So this is a minimally invasive surgery, and the person can be made to stand from the very next day of surgery. There are improvements in the types of PFN that we get. We have percutaneous femoral nail with helical screws for better fixation. These are all titanium nails generally. It can be steel or titanium, but titanium is preferred. So these are the various type of nails that we have got. Now if the fracture is intracapsular along with multiple screws, we can also use a plate which provides more stability and early weight bearing. The advantage of using screw with plate along with just screw is that it provides early weight bearing. So this can also be done. Similarly, we have something called DHS. We have something called DHS or dynamic hip screw. In this there is a plate and there is a screw which slides inside it and telescopes inside it, and this is used in extracapsular type of fracture. This is known as dynamic hip screw or DHS. This is used in extracapsular type of fracture, and the person can be made to stand from the next day of surgery if the fixation is stable and if the fracture is stable, or else it will take few weeks or to make the person walk. Now if we are dealing with intracapsular fracture wherein there has been delay in starting the treatment, bringing the patient to the hospital, or the age is more wherein we suspect that the fracture will not unite, or where there has been a fixation leading to fracture union, but there is something called avascular necrosis, means the blood supply of the femoral head is jeopardized and that leads to dead bone. In that case we have to replace it with a prosthesis which is known as hip replacement. So the fracture neck femur, we can replace it with a prosthesis which is known as hip replacement. So this is what is hip replacement. The ball and cup mechanism, it is replaced by a artificial thing made up of titanium and cobalt chromium alloy. So this is known as hip replacement. In X-ray it looks something like this. In X-ray it looks something like this. This is hip replacement, total hip replacement for a intracapsular neck femur fracture. X-ray it looks something like this. This is the cup which has been replaced, this is the ball, and this is the stem of the prosthesis. Just to understand it, another diagram, this is another diagram wherein the components of the hip replacement are shown. This is the pelvis bone and here is the hip joint which had fractured. So we have replaced it with the artificial hip joint which is known as hip replacement. This is the cup. This is the cup, acetabular component. This is known as acetabular component of the cup. It has got a liner plastic shell and head of femur. There is head of femur and this is the stem which goes inside the femoral shaft or the thigh bone. So the advantage of hip replacement is that the results are very predictable. We don't have to wait for bony union. The results are very predictable and the person starts walking from the very next day. Walking and full normal life can be resumed within few weeks itself. Sometimes when a person is not fit enough for total hip replacement, or the person is too old wherein we don't expect him to go out of house and move about much, in that case we need to do something called partial hip replacement which is known as hemiarthroplasty of hip joint. In that case we use where only the ball is replaced by a bipolar hip joint. This is known as a bipolar prosthesis, and only the hip is replaced, only the ball is replaced and the cup is left. So this is known as hemiarthroplasty. So just we have seen the various treatment modalities of neck femur fracture. Why we have discussed all this and why we need to understand is that the treatment modalities differ, the outcome, the speed of recovery differs, and the rehabilitation speed, means whether the person will walk from the very next day or the person will walk after few weeks. All these things differ depending on the type of fracture, the personality of fracture and the stability of fracture. So this ends our discussion on femoral neck fracture.